Dr. Essa. If you haven't seen my channel before, I talk about skincare, and please subscribe to my channel. There's a lot of good information on here, and I'm gonna just make more and more. So with that, let's get started on a very favorite topic of mine, retinoids. So there are not too many products that I believe make a huge difference in how our skin ages. Retinoids are the most highly recommended by dermatologists since they are without a doubt proven to improve the cellular function of aged and photo-damaged skin. You're doing yourself a huge disservice if you're not using a retinoid by the time you're in your 30s, and I'm going to tell you why. Retinoids are actually vitamin A derivatives. They were first used on patients with acne, and then they noticed that these patients had positive effects in terms of wrinkles and aging. Overall, they are the most proven product to, without a doubt, improve the cellular function of aged and photo-aged skin. And they help to improve the texture, wrinkles, and diminish brown spots. Overall, they just give your skin that healthy glow. The first thing retinoids do is that they increase cell turnover, or increase the regeneration of new cells, which actually slows down as we get older. They work by encouraging basal cells, which is the lowest layer of your skin, to divide, and as a result you get more new epidermal cells, which are on the top, and eventually that becomes the rooftop. The most powerful effect that retinoids have are on collagen, which are the building blocks of our skin. So, you know how babies have that perfect, plump, smooth appearance? This is because they have a ton of collagen in their skin. If you recall, collagen provides our skin with that structural framework, and unfortunately, it decreases every year by 1 to 1.7% starting in our 20s. Retinoids have a dual effect on collagen. Not only do they help decrease the amount of collagen breakdown from sun exposure and preventing the rise of an enzyme called collagenase, but they also stimulate the production of collagen. One more added effect is that they also stimulate new blood vessels in the skin. And this gives the skin more of a rosy appearance, fading age spots, and reduces precancerous skin called actinic keratosis. There are different forms, and depending on what type it is and the percentage determines how effective and how strong the retinoids act on your skin. Historically, there are the most studies on these anti-aging compounds. So Retin-A, or tretinoin, was first used as an acne treatment in the 1970s because it unclogged pores. But researchers discovered that it improved hyperpigmentation and speeded up the turnover of skin cells. So first, the prescribed retinoids are tretinoin, which is the generic, and Retin-A is the brand name, tazarotene or Tazorac, and adapalene or Differin. Tretinoin and tazarotene are prescribed, and adapalene, which used to be prescribed, is actually on the shelf now, and it's fairly inexpensive. There have been the most studies on these products and show considerable proof of rejuvenating your skin by decreasing fine lines and wrinkles. These three do not need to be converted in your skin, and they are already in the proper form for your skin to use. They can, however, cause more side effects like redness, irritation, and peeling. However, if you do have acne, these products are very efficacious. So now I will talk about products which are thought of as cousins of the retinoids and are over the counter. These include retinol palmitate, which is the weakest formulation, followed by retinaldehyde or retinol, followed by retinols. All of these have to be first converted to retinoic acid by your skin before they are used. These three are synthetic and are usually less irritating to the skin. So it can be really confusing trying to determine what type of these products to use. And the retinoid classification system is so confusing, and it's difficult to know which product to pick. Many experts claim that using a prescribed tretinoin is the most effective way of preventing aging. However, there are great over-the-counter products, and you do not need prescription strength to get the same collagen building effect and cell turnover. A high-dose prescription product may be a little faster than when using a milder over-the-counter formula, but you may also get some more irritation from the prescription strength. Plus, what's the point of getting irritation from a product you're trying to use to make your skin beautiful? A lot of people quit using it when getting peeling and irritation as well. I always say use products or practice things in your life that you can do consistently, and you'll hear me say this over and over again. My favorite over-the-counter product contains 1% retinol, but no less than 0.5%. If this is too irritating to your skin, you can start with a product with retinaldehyde or retinol palmitate, and then move on to retinol. You'll want to start once or twice a week, move up to every other day, and then once a day. This is dependent on how sensitive your skin is. Remember, it does not need to cause peeling or redness for it to actually work. Some people still believe this, but it's actually just a myth. Find a product that is gentle enough and start slowly. Remember that it can take 3 to 6 months of use to achieve noticeable results. If you do prefer a prescribed tretinoin, 0.05% is a good concentration, but it will be up to your doctor to manage this. This may also be good for people with acne. You'll want to use a pea-sized amount because using too much can cause irritation. You'll want to do it at night because they are photo-inactivated, meaning that the sunlight will break them down and make them less effective. So after your nighttime cleansing routine and after your skin is dry is the best time to place it on. If your skin is damp, it will increase the absorption and may cause more irritation. I hope you enjoyed this information on retinoids. It is a fabulous product to use when you are even starting in your 20s. Like, I wish I had started it in my 20s, especially in your 30s and 40s, 50s, and so forth. You will definitely notice the difference in your skin. Please subscribe to my channel, and I hope you're having a great week. Thanks a lot and take care.